Hello, so today we're going to present our data analysis in R about thyroid cancer. We have our introduction here. Um, we can see the thyroid cancer disease explanation here, which is on the web. You can see. We will look at the correlation between age, gender, smoking habits, risk, and recurrence for thyroid cancer patients. We formed three hypotheses and then proceeded to conduct tests to determine if the validity of said hypothesis is true. So, for our data collection, we used the data sets. So that was sourced by US Arvin machine learning repository. We took 100 row sample in this data set. This data set has been monitored for at least 10 years, so there aren't any problems with the data in it, most likely. Age, we have our columns here: age, gender, smoking, HX smoking, which means if the patient has a smoking history, risk, and recur is whether the cancer has recurred after the initial treatment. And so we have our distributions here. I'm gonna quickly pass it by. We have our risk and age distributions here. So we have our plots and normal distribution, our standard normal distribution, our risk plot. As we can see in the background of here, we have a histogram showing us that the interval of the age that have a higher probability of having thyroid cancer. And that's it for me.
Okay, so one of the hypotheses that we tested for our dataset was that between the thyroid cancer patients, are there more ex-smokers than new smokers? With the information on whether the patients smoke or if they have a history of smoking, we created four new groups to better understand if smoking has any effect on thyroid cancer occurrence. These groups are active smokers, ex-smokers, new smokers, and never smokers. By observing our visual representation, the smoking status distribution bar chart we can see at the right, we can see that the new smokers are not less than ex-smokers. In fact, we can see that the ex-smoker group has the second least amount of people in it, with active smokers, people having the least amount, and never smoker group having the most people.
The other topic that we focus on is that does the thyroid cancer recurrence happen more in males or females? Thyroid cancer, which can be seen in all age groups in both males and females, in some cases the thyroid cancer can reoccur after treatment. As we can see from the graphs we obtained by analyzing the data from our dataset, the likelihood of reoccurrence is higher for males. Even though the number of female patients is higher, after calculation, it can be observed that the percentage of reoccurrence is noticeably higher for males. A goodness of fit test is a statistical method used to assess how well observed data matches expected data. Goodness of fit tests provide insights into whether observed data align with expected outcomes, enabling decision-making based on hypothesis test results. Chi-square tests specifically examine relationships between categorical variables and evaluate how well the sample data represents the entire population. These tests measure the closeness of the observed data to the expected data, determining the goodness of it.
So non-parametric tests are statistical analysis methods that do not rely on meeting specific distributional assumptions, particularly when dealing with data that is not normally distributed. Non-parametric tests are not replacements for parametric tests, but rather complementary methods. For our dataset, we chose to use the Wilcoxon signed rank test, which was applied to data between margins of smokers that we made by grouping two columns that we have talked about before. Me weight new that I previously explained referred to as smoking status.
Analysis of variance ANOVA serves as a statistical tool to assess how a numerical dependent variable changes concerning one or more categorical independent variables. ANOVA specifically evaluates whether there exists a difference in the means of groups across various levels of the independent variable. In ANOVA, the null hypothesis posits no difference in means, while the alternative hypothesis suggests differences among the means. For instance, a one-way ANOVA scenario using observations from a hypothetical study on the impacts of 3 distinct fertilizer types on crop yield. Additionally, a two-way ANOVA example is presented where this study incorporates an additional independent variable, planting density. In this instance, the effects of 3 fertilizer types and 2 planting densities on crop yield are examined.
So lastly, we have our linear regression model here. And in this model, we can see that the older you get, you have a higher chance of getting cancer. And that's it for this graph. And lastly, thank you for listening to us and watching our presentation.